You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Folks, we talked about the whole issue of testing and also this impact on African Americans. Well, again today at the White House coronavirus briefing, it came up. And the Surgeon General, Jerome Adams, made some comments. So we're going to play those comments first, and then we're going to play the second part was a question that came from Yamiche Alcindor of PBS, where she asked him to clarify those particular comments. And so we want to talk about with our next guest and our panel the issue of testing as well as his comments. And so this is what the Surgeon General, Jerome Adams, said today.
And I want to close by saying that while your state and local health departments and those of us in public service are working day and night to help stop the spread of COVID-19 and to protect you regardless of your color, your creed, or your geography, I need you to know you are not helpless. And it's even more important that in communities of color, we adhere to the task force guidelines to slow the spread. Stay at home if possible. If you must go out, maintain 6 feet of distance between you and everyone else, and wear a mask if you're going to be within 6 feet of others. Wash your hands more often than you ever dreamed possible. Avoid alcohol, tobacco, and drugs. And call your friends and family. Check in on your mother. She wants to hear from you right now. And speaking of mothers, we need you to do this, if not for yourself, then for your abuela. Do it for your granddaddy. Do it for your big mama. Do it for your pop-pop. We need you to understand, especially in communities of color, we need you to step up and help stop the spread so that we can protect those who are most vulnerable.
That did not quite sit well with a few people. Yamiche Alcindor noticed that. She then, later in the news conference, asked this question.
Thank you, Mr. Surgeon General.
Thank you very much.
Thank you. I have a quick question for you. You said that African Americans and Latinos should avoid alcohol, drugs, and tobacco. You also said do it for your abuela, do it for Big Mama and Pop Pop. There are some people already there are some people online that are already offended by that language and the idea that you're saying behaviors might be leading to these high death rates. Could you talk about whether or not could you, I guess, have a response for people who might be offended by the language that you used?
Well, I use that language because that's the language. I've been meeting with the NAACP, with the National Medical Association, with others. I actually talked with Derek Johnson multiple times this week, the head of the NAACP, and we need targeted outreach to the African American community. And I use the language that is used in my family. I have a Puerto Rican brother-in-law. I call my granddaddy, granddaddy. I have relatives who call their grandparents Big Mama. So that was not meant to be offensive. That's the language that we use and that I use, and we need to continue to target our outreach to those communities. It is critically important that they understand it's not just about them. And I was very clear about that. It's not just about what you do, but you also are not helpless. We need to do our part at the federal level. We need people to do their parts at the state level, and we need everyone, black, brown, white, whatever color you are, to follow the president's guidelines, the coronavirus guidelines, and do their part. Because when I talked to the NAACP 3 weeks ago, it's important to note that one of the things they asked me was, can you help dispel the myths in this community that people actually can't get coronavirus if they're black? That was a myth that was out there that's actually very important for us to squash here.
And that all Americans avoid tobacco, alcohol, and drug use at this time?
Absolutely. It's especially important for people who are at risk and with comorbidities, but yes, all Americans. So thank you, and I will clarify that. All Americans need to avoid these substances at all times. I put out a smoking cessation report in January. I put out an advisory against youth and pregnant women using marijuana last year, and that was not directed towards any one race. That's everybody needs to do everything they can to be as healthy as possible at this critical time. Dr. Fauci, would you add anything?
Yeah, I think you said it perfectly, Jerome. Thank you. Would you like to add anything to it? Because you are really, you expressed it very beautifully before.
No, I mean, Jerome, you did it beautifully. I can't do it any better than that. And I know Jerome personally, and I can just testify that he made no not even a hint of being offensive at all with that comment. I thought that was appropriate. Thanks.
And I can tell you, Jerome has done a fantastic job, our Surgeon General. I just hope nobody steals him and he goes.
Gotcha. I don't care what Trump has to say. Don't give a damn what he has to say. That's why we don't show any of his comments. All right, folks, joining us right now is Dr. Ebony Jade Hilton, Associate Professor of Anesthesiology and Critical Care Medicine at the University of Virginia. Also on our panel is Dr. Neon B. Carter, Department of Political Science, Howard University. Dr. Mustafa Santiago Ali, former Senior Advisor for Environmental Justice, EPA, and Rob Richardson, host Disruption Now podcast. All right, Dr. Hilton, I want to start with you. First and foremost, I want to deal with you with testing, okay? Donald Trump says, oh, no, look, we don't need any national testing. And he talks about how great we are, how wonderful we are, how we're doing a great job. But the numbers simply show he's a liar. The reality is other countries have done a much better job of testing a higher percentage of their population, and they have a better understanding of this virus than we do. Yes or no?
Yes. And that's a full sentence. I mean, when we're talking about testing, it's just like Representative Thompson said. When we're looking at the sheer volume, 2.2 million sounds like a lot of tests. But when you take that into consideration with how many people we have in our population, that's only for 1 million people, 7,000 tests. And I'll tell you the effect of that. If you look at in South Carolina, for instance, where I'm from, right now, the number of confirmed cases that they say they have is about 3,065 confirmed cases. However, if you look at the South Carolina DHEC page, they've done a great job, and I want to applaud the people who are actually running this website, because what they say is that we have 3,065 confirmed tests, but we have a total of 21,290 presumed positive people. And the reason why it's presumed positive is these people have symptoms, but they don't have access to the test. And that is a problem.
And we're seeing these stories at the Hilton of more people going to the doctor, trying to go to the hospital, getting turned away. There's a bus driver in Detroit. He ends up dying. A 65-year-old black woman in Atlanta, not showing any signs of symptoms. She later dies. And we're seeing that. And again, all of these promises. I'm still trying to figure out where's the drive-through testing that was promised at CVS and Walgreens and Walmart and using these parking lots. And then Trump's like, no, we're not going to do it. We're not going to do it. And so we're sitting here, and to be perfectly honest, I think most people, we have no idea who the hell has it. And it's just, and the people who say, well, this is no different than the flu. No, guess what? If I see you hacking, wheezing, coughing, I'm like, keep your ass on that side of the room. Okay?
Right.
With this, you can't tell if somebody has it.
Exactly. And that truly is one of the problems that we see. And what we know, too, what we have to take into consideration is they oftentimes say, oh, stay at home, as if people have the privilege of being able to stay at home. 1 in every 5 African Americans literally cannot do a remote work. They can't take their work home with them. And we know that just like this virus kills, so does poverty. And if I cannot feed and keep shelter over my family, if I don't have a choice in that, then what do you expect me to do? You know, this administration has lied on many different levels. But even as far as 2 days ago, they made an announcement that they were going to start to hold federal funding for these drive-through testings. And we haven't even reached a peak in New York at this point. You know, we keep saying we've reached this peak, and yet they had the highest death count yesterday, and their counts are still climbing. So we haven't reached a peak. So how are you even attempting to consider withholding funding for drive-through testing? It is absolutely negligent, and we need people. And when I say people, I expect Dr. Fauci. I expect Dr. Adams, who is also a fellow anesthesiologist. I expect you to hold truth to truth. We took an oath to first do no harm. And so we cannot dance around the truth. We have to start stating it as a fact and put a period on the end of it and then stop the sentence.
I want to ask you this. I'm going to bring in my panel after you respond to this. And so you heard what the Surgeon General, Jerome Adams, said there when the question came up regarding African Americans. And then he makes this point about don't do drugs, don't do alcohol, things along those lines. Then Yamiche asked him, because a lot of people have been offended. In fact, this is what Reverend William Dr. Barber said in a video that he posted immediately after hearing these comments.
Hello, Roland, and to all of your audience. Let me first of all, Roland, thank you for what you continue to do to push truth and justice throughout this country and literally throughout the world. You know, we are in a difficult moment, and I wanted to come on today as a pastor and as a bishop first, as we examine where we are. I was deeply troubled today when the Surgeon General constantly tried to use and invoke the name of the NAACP as he suggested to Black people that the reason we are dying and catching this virus more than others has to do with our need to stop drinking and smoking tobacco and using drugs, and not addressing the evils and the drugs and the drunkenness that America has had with racism and with inequality. And the fact of the matter is that Trump, Pence, and many of the other Republican governors and legislators have actually exacerbated the denial of health care all over this country, the denial of living wages, the very thing that public health PhDs, public health specialists tell us, that the pandemic spreads through the fissures and the wounds that have been created by historic racism and the criminalization of poverty. We cannot stand for that. I hope that, and I've said that to the leadership of the NAACP, that they can't use us like that and wrongfully use it. I know that's not our position, but to attempt to do that on worldwide TV is ugly, and to attempt to do it as an African American is beyond disrespect. And for Pence and Trump to buy into it, it doesn't matter how many African American leaders they may have talked to today, which they claim they did, they talked and did not listen. And they really believe that they can continue to disrespect our communities, even in the face of dying. Now, in addition to that, I wanted to...
All right, so I'm going to hold those comments. He has some additional comments about churches this weekend. I'm going to hold those comments. But Doc, your thoughts on what he had to say? And again, Surgeon General, did he slip up? Did he make a mistake? Was it smart to later have to walk that back and clarify it?
No, it wasn't a slip up or a mistake. It was stated, and I took offense to it personally, and several different things. For one, Dr. Fauci and President Trump, you can't tell if you're not the targeted population of an insult, then you can't tell us whether or not we can be offended by it. Point number two, being that African Americans typically are always given this stereotype that it's our lifestyle choices that are leading to us having these incidences of worse outcomes in health, but yet we at this point have a national crisis of an opioid epidemic, and it's not treated in the same way, and it's not spoken to in the negative light in the same way as what impacted Black and brown community. The third point was that he mentioned that he talked to the NAACP 3 weeks ago. Now, 3 weeks ago, we were dealing with deaths of maybe 500. Today, we have deaths of over 18,000. And so if you haven't reached back out to the NAACP or the Congressional Black Caucus, of which I've been in contact with Congresswoman Bass and Representative Robin Kelly, who've been absolutely fantastic. They literally hold town hall meetings pretty much every week. There's something going on of where they're trying to reach the constituents to say, what do you need so we can form these policies? So if you haven't reached out to these groups in 3 weeks, then I'm gonna need you to go ahead and make a schedule. And then the final point is you cannot talk about all these comorbidities that they are linking to and saying we're at higher risk for. You can't talk about those unless you are willing to also get on that stage and point out and address the systemic racism that has set up every platform. And if we're talking about drugs and alcohol and the lack of mental and social support, then talk about the fact that we don't have any hospitals and clinics that are put into our communities. Talk about the fact that if we're talking about these chronic respiratory illnesses and asthma that our children are dealing with, Then talk about the fact that industries are targeted towards the Black and brown and the lower income level communities and polluting our air and polluting our water. If you're going to talk about hypertension and diabetes and obesity, talk about the fact that there's no sidewalks within our community, or that there's no eateries, and we have this food apartheid where we can't buy any fresh food and groceries, but we can go to the corner store because that's all that was put there from the redlining from 1930s on. So including from his president. So if we're talking about all those things, I hold Dr. Adams responsible as a fellow anesthesiologist, for one, but I hold him responsible as take away my white coat. At the end of the day, I'm a Black woman trying to do what's best for my Black community. And what I know about Black people is that we're honest people. We work hard to promote community at all fronts. We've always banded together to take care of ourselves and to take care of not only ourselves, but other people. And to suggest that we are the cause of our own hurts and not that we are the victims of the system that was set up for us to fail in the first place, I feel like it's personally a slap to the face to the African American community that will always be there to support you.
Dr. Nyambe Carter, your thoughts?
I mean, similar to the doctor, I thought that was very irresponsible. And even the way he framed it as if you do these things, then this disease will go away. And we know that isn't how viruses work. And I think the insult was like the big mom and the abuela, like, don't try to use this sort of code switching language as if Black people and Latino people and other people don't understand what you're saying. We know that shelter in place is important, but we also know that Black people have jobs most of the time that they can't telework. So they're going to be at work. They're going to be on public transportation more often. They're going to go back to communities that don't have access to adequate healthcare facilities. And we know that there's also on the other side of that physicians and others who are making decisions about who these people are and whether they're worthy of tests and whether they'll be compliant and all these other things. And I think for him to say it this way was just really irresponsible and almost single Black folks out, because as the doctor rightly points out, we're talking about lots of other communities that use illicit substances way more than Black folks. And yet you didn't tell them to stop using their drugs, to stop drinking, and to stop smoking to stem the spread of this virus. And I think the health issue is being lost in all of this because you don't want to take responsibility for ultimately why these communities are finding themselves sicker and dying more often from this disease than other folks.
All right, folks, back to that Roland Unfiltered video in just one moment. All right, so a lot of y'all always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they basically about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, it gives you that flower effect like that. But if I wanted to also, unlike because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, it goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it.